that continuity of care for 900 years on the same site is obviously unique. And what's so amazing is that we have the records of so much of that story. We've got a huge number of deeds from the medieval period, governor's minutes from the 16th century onwards. We've got case notes, objects and paintings and uniforms. So it's a real breadth of material. With medical history, it's really important to understand where we've come from and to understand the progress and the mistakes of the past and the kind of the humanity of the patients and the staff who went before. Barts was founded in 1123. Ray here, the founder, had become very ill when he'd been on a pilgrimage to Rome and promised God that if he was able to return to London, he would found a hospital.
To have set up a hospital for those that couldn't afford healthcare, in other words, the NHS for the people of the City of London, 900 years ago is an astonishing thing to have done at a time when our views of human rights, of society, were so radically different. 1180, a book of foundation was published, and in that are patient histories. So we know the names of some of the patients from nearly 900 years ago. So a guy called Alfuin from Dunwich came here with severe contractures, and probably due to good physiotherapy, he regained his job as a carpenter. Now Dunwich is now under the North Sea, and that shows you what a long time ago it was.
Physically, the hospital has two eras. It has the medieval period up to the 17th century, where the hospital wards were around a cloister, and you had gardens, dwellings, and a school on it. And obviously medieval hospitals couldn't necessarily offer a cure, but they offered a place for kind of respite for the soul. And then with the Gibbs rebuilding, it takes that idea of the cloister, the open space for patients and staff to enjoy, and expands that with the kind of 18th century ideas about infection control, and has wings with air circulating around them. And that's when you get the hospital, which actually doesn't look that different today.
A great building, a great history means nothing without attracting the very best staff and letting them get on and do their job of treating patients. To be in a hospital where William Harvey described the circulation of the blood in a lecture here in 1619 gives you an idea of what we have to live up to.
There's people like Isla Stewart and Ethel Bedford Fenwick, who were matrons in the late 19th and early 20th century, who were really key figures in the drive for registration of nursing. Medical education has always been a huge part of the tradition at Barts. The medical school wasn't formally established until the mid-19th century, but we know that there were medical students from at least the 17th century because there are records of complaints that they were being too rowdy out in the hospital spaces. I think some of the key moments of the hospital's history are times when its existence has been threatened, and it's come out of that with a new identity, a kind of renewed sense of purpose. One of the biggest moments is the refoundation of the hospital by Henry VIII after the dissolution of the monasteries threatened its financial future. The petitions which were made to Henry VIII were from the citizens of London saying we need this place to survive. And when he did refound the hospital, that link was formalised. The first governors were aldermen and councillors of the city. So there's always been that kind of really strong support from the businesses that represent the city. And then you get the moments like the Great Fire of London and Second World War and the Blitz. There were direct hits on the site. You can still see shrapnel marks in the screen wall at the front of the hospital. And in more recent times, you've got the Save Barts campaign, which followed the 1992 Tomlinson report, which proposed significant changes, which would have involved closure of the services on the hospital site. And that itself has been the driver for the hospital as we see it today.
So I was like 19 years old coming here, and I just remember the sort of magnitude and the greatness of coming through the big arch and thinking, wow, there's a lot of history here.
You're walking in other people's footsteps, so you're taking part in something very special.
You just have a sense of something going beyond you.
Imagine you're actually standing on that ground where these people had walked before.
This hospital has survived and it's come through better, stronger, but still with the same caring attitude, the same commitment to healthcare. I think it talks to everybody. The history of what's been achieved is so powerful, inspiring.
I just often think, well, wouldn't Rahir be very proud of his hospital nearly 900 years later, serving the communities in East London and indeed more broadly, nationally and internationally.